Some signs are easy to miss unless you know what you're looking for. So, did you know that your lips should be closed and your tongue should actually be resting on the top of your mouth? If yours isn't, your child's may not be either, and that may be leading to some of the symptoms. Things that we monitor for, of course, open mouth posture, snoring or audible breathing, grinding, long-term bedwetting, thumb habits. We also watch for things like picky eaters because muscle development can affect the way that we chew. Speech delays, we start looking for that early on, or maybe you have your child has a clarity concern. Some of these things are contributed by function of the tongue.